Hi, this is Jessica DaMassa with WTF Health, and I am here with Matthew Holt. He is the founder of S.M.A.C Health, which is unbelievable because I thought that your career had crashed and burned with the sale of Health 2.0 to HIMSS.
Well, why do you think you're wrong?
I never said I wasn't. So why don't you tell me about S.M.A.C Health and what you're trying to do now?
Thank you, Jessica. So, Jessica, these days I'm doing a lot of different things. As you correctly said, Indu and I sold the conference business of Health 2.0, but not our Catalyst group, which does innovation programs and challenges. We still own that. For one will be working away in New York on our behalf. The conference business, that team, including Indu, went to work for HIMSS. However, we are at a Health 2.0 conference, mixed with a HIMSS conference in Europe, right? Which is, and what's going on there is that I am still a
Person of interest?
Person of interest, conference content lead. I gave a keynote with Indu. I led 3 panels, so I'm still working away. I'm still busy with Health 2.0. Having said that, you are correct to say that there's some other stuff going on as well. And yes, I have a new initiative called S.M.A.C Health. But the most important initiative I have is something called Health in 2.0, which I think you should know something about.
I know all about that, and it's fantastic. It's the best 2 minutes of health and technology questions that anybody can ever ask. It is. And then the answers are okay too sometimes. But more importantly, I want to talk to you for a minute about the S.M.A.C Health thing, because I feel like a lot of people need to understand what it is that you're trying to do here. So talk about your model, talk about who you're trying to help, because this is something I feel like you've been doing in the industry for free for a really long time. And so now we're adding a price tag to it, people. And so the value of services has gone up as well as the price. So tell us what you're doing with S.M.A.C Health.
Well, the price may have gone up. We'll see about the value later. So there are 2 aspects to this. So first, what is S.M.A.C Health? So I coined this about 3 years ago, and we've touched on this once or twice. But it's a term that Connexiant, the big consulting company, they started calling something S.M.A.C, which was, they called it social, mobile, analytics, and cloud. I added sensors, which is social and sensors, mobile, analytics, and cloud, and a K for kindness, because we need to be empathetic in healthcare.
As if there was anybody to add that K. This guy is the guy to answer.
I am the kindest person there is, especially in healthcare. All right, so S.M.A.C Health, right, is the idea of, the notion is that we haven't been calling this sector of the industry the right thing. We've been calling it digital health, M-health, e-health, God knows what else, even Health 2.0 for a while, and that's not quite right, because the set of technologies, the social technologies, the sensors, the mobile operating systems, the analytics, the big data analytics, and the cloud-based tools, the cloud-based storage, that sort of technologies has really transformed every other industry. It hasn't quite made it into healthcare yet, although almost all the things you see around the floor at Health 2.0, and once you get outside the big iron EMR vendors, all of that stuff, which is relatively new in healthcare, needs to come in, but it's pretty much prevalent in the world, the stuff you use every day at Facebook, Google, Amazon, etc. So that's the notion about what S.M.A.C is. Now, Jennifer Lannon, who's hanging around here somewhere from .health, approached me one day and said, hey, why don't you start the website S.M.A.C Health? So I did. And a little while after my career, as you said, what did you say?
Crashed and burned.
Career crashed and burned after I started Health 2.0. Unusual terminology, but I'll take it from you because I love you.
Flatlined? Is that more appropriate for healthcare? Flatlined? Would you say it flatlined?
Well,
it's resuscitated now?
So a number of people with the panels got there and said, hey, can you help me with this problem I have with my startup? Now, yes, people have done this forever and ever, and I'd always said, that's great. Can you please, as recompense, come to Health 2.0 and buy a booth? And now I'm saying, can you instead join my program where I'm going to help you with a whole range of services around CEO advice. I'm going to help you with some other services around the whole idea of lightweight outsourcing, the fix your graphics and your website and that kind of stuff. And a third group of services are introductions to experts and introductions to my wider network of customers, venture capitalists, partners, potential employees. So I'm going to create a little group of startups. I've already got a number on board who are going to not work together, but work with me, be a group together, and I'm going to enable other organizations, be they investors, be they corporates, or political government agencies, to work with them and hopefully get everyone quite a bit further down that path of getting their new ideas, their new products, really to get some traction.
That's fantastic. And I know, for as much as we give you a hard time, you are a good soul and you do have some really good advice for startups and always have. You're spot on usually with who you've selected to work with and who you've brought on the Health 2.0 stage. So this is a really cool service that you're willing to provide. And the other thing I want to draw attention to that you're probably not going to like is that it's really something that you developed a business model around that was affordable for startups to do it. So do you want to talk about that a little bit?
Absolutely. So there's absolute transparency. Blind transparency is the wrong term. Absolute transparency. This service is for one level of it, for the startup advice, it's $5,000 a year, which isn't supposed to be too much. And for the outsourced technical help, that's somewhere between $2,000 and $10,000 a year on top of that. The experts cost more money, but that's introductions to experts. And there are some other goodies that come along with that, which I can describe. If anyone wants to go to S.M.A.C Health, they'll see it. But right now, it's intended to be an affordable, all-you-can-eat buffet of my advisory services, and hopefully my buffet won't be cleared out too soon.
Fantastic. Well, I'm not going to make a terrible joke there because I feel like we've ribbed you enough, but there was one, and you can maybe see it in a Health in 2.00 episode one day soon. Matthew, it's always a pleasure to talk to you. Seriously, the best of luck with S.M.A.C Health. It really is a very good endeavor. Proud of you for starting this on your own. And then anybody can catch the two of us together with this amazing give and take on our it's like twice a week, twice fortnightly show, Health in 2.00. Oh, there's our little card where we're little cartoons. and experience the magic for at least 2 minutes twice a week. Matthew, thanks so much for joining us. This is Jessica DaMassa with WTF Health. Thanks so much.